The respiratory system is made up of three main parts: the brain, control center, sensors, and effectors. 1. Brain, central control center. The brainstem, which is in the brain, has special areas in the pons and medulla that help control breathing, both inhaling and exhaling. These areas work with other parts of the brain to make sure you breathe properly. 2. Sensors. The body has sensors that gather information about important things like the oxygen, O2, and carbon dioxide, CO2, levels in the blood, how much the lungs are stretching, and if there are any irritants, like dust or smoke in the airways. 3. Effectors. The brain sends messages through nerves, like the phrenic nerve, to control how fast or slow you breathe and how deep or shallow your breaths are. It does this based on the information it gets from the sensors. If there is any damage or problem with the brainstem, nerves, or sensors, it can cause problems with breathing, and you may notice specific signs or symptoms. Accessory muscle breathing. Normally, when you breathe in, inspiration, your diaphragm does most of the work, and when you breathe out, expiration, it happens automatically because your lungs naturally return to their normal shape. What is accessory muscle breathing? Sometimes, when breathing becomes harder, like during certain health problems, your body uses extra muscles to help. These extra muscles include sternocleidomastoid in your neck, scalene in your neck, trapezius in your upper back and neck, internal intercostal between your ribs, abdominal muscles. When these muscles are used for breathing, it's called accessory muscle breathing. Conditions that cause it. This happens in diseases or conditions that make breathing harder, such as chronic obstructive pulmonary disease, COPD, asthma, pneumonia, pneumothorax, collapsed lung, pulmonary embolism, blood clot in the lungs, congestive heart failure, CHF. How it works. When you need to breathe harder or faster, these accessory muscles help. Inspiration, breathing in. The sternocleidomastoid and scalene muscles help lift and expand the chest, lowering the pressure inside your chest so more air can enter the lungs. Expiration, breathing out. The abdominal muscles help push air out of the lungs more forcefully. Why it matters. The use of accessory muscles isn't a disease itself, but it shows that breathing is more difficult than normal. It can help doctors see how serious a breathing problem is. For example, most acute flare-ups of COPD, more than 90%, involve the use of these muscles. In children, using these muscles to breathe is a clear sign that they're struggling to breathe. Agonal respiration. Agonal respiration refers to slow, irregular breaths with long pauses in between. People experiencing agonal breathing often appear to be gasping for air. This type of breathing typically happens right before death unless immediate medical help is given. Conditions associated with agonal respiration. Agonal breathing can happen in any serious medical situation where death is close, like cardiac arrest, severe trauma, brain injury. How it works. Agonal respiration is believed to be a reflex from the brainstem, which is the part of the brain that controls basic functions like breathing. It's the body's final attempt to keep breathing before it stops completely, terminal apnea. It's like the last effort to try to breathe before death. Why it matters. Agonal breathing is a serious sign that death is near. If noticed, it should prompt immediate action. Recognizing agonal breathing quickly can help doctors or emergency responders identify cardiac arrest early. In some cases, emergency dispatchers can use this information to guide responders more quickly. Agonal breathing must be treated as an emergency and managed without delay. Apneustic breathing. What is apneustic breathing? Apneustic breathing is when a person takes deep, gasping breaths that last a long time, followed by short and weak exhalations. The deep inhalation is interrupted by the lungs naturally trying to push air out, but the exhale isn't enough. Conditions associated with apneustic breathing. This type of breathing is usually seen in people with brainstem injury. The brainstem controls breathing, so any damage to this area can affect normal breathing patterns. How it works. The exact cause of apneustic breathing isn't fully understood, but it seems to happen when there's damage to the brainstem, especially to a part called the pons. This part of the brainstem helps control breathing. In apneustic breathing, the part of the brain that controls inhalation becomes overactive, causing long, deep breaths with little to no normal exhalation. Why it matters. Apneustic breathing is a rare and unusual sign, and it's often linked to brainstem problems. While it can suggest that there's damage to the brainstem, it's not specific enough to pinpoint exactly where the problem is. It doesn't happen often, and its exact value in diagnosing brainstem injury is unclear. Apnea. What is apnea? Apnea is when breathing stops for a period of time. This can happen during sleep or in other situations where the brain or airways are affected. Conditions associated with apnea. 1. Central sleep apnea, CSA, when the brain doesn't send the signal to breathe. Brainstem injuries, like stroke or trauma. Heart failure, CHF. Use of opiate drugs, e.g., painkillers. Obesity-related breathing problems, Pickwickian syndrome. 2. Obstructive sleep apnea, OA, when something blocks the airway while breathing. Obesity, small jaw, micrognathia. Alcohol use, enlarged tonsils or adenoids. How it works. Apnea can be central or obstructive, depending on what causes it. Central sleep apnea, CSA. This happens when the brain doesn't tell the body to breathe. This could be due to brainstem damage, drugs like opiates, or conditions like obesity. Sometimes the body can't send signals to the breathing muscles, so the person stops breathing temporarily. Obstructive sleep apnea, OSA. This happens when the airway becomes blocked during sleep. For example, the tongue or soft palate can fall back and block the throat. Factors like obesity, small jaw, or enlarged tonsils can make this more likely. Alcohol can also relax the muscles in the throat, causing the airway to collapse. Why it matters. Apnea, especially if it happens often, can cause serious health problems. It can affect blood sugar control, raise blood pressure, and increase the risk of heart disease, strokes, and heart failure. It also reduces sleep quality, leading to tiredness and irritability during the day. If someone experiences these symptoms, apnea should be suspected. Asterixis. What is asterixis? Asterixis is when a person's hands or arms show a sudden brief flapping movement when they try to hold their arms out with their hands tilted back, dorsiflexed. The movement happens in a rhythm and is usually slow, with about 3 to 5 movements per second. It can happen on one side of the body, unilateral, or both sides, bilateral. Conditions that can cause asterixis. 1. More common causes. Hypercapnia. This means having too much carbon dioxide, CO2, in the blood, often seen in conditions like chronic obstructive pulmonary disease, COPD. Liver disease. When the liver is not working properly, it can cause toxins to build up in the body. Kidney failure. When the kidneys don't filter waste properly, toxins can affect the nervous system. 2. Less common causes. CNS, central nervous system problems, such as a stroke, ischemia, or bleeding, hemorrhage, in the brain. Drug-induced. Some drugs can affect the nervous system and cause asterixis. How it works. The exact cause of asterixis isn't fully understood, but it's believed to involve problems with how the brain and muscles work together. This could be due to general dysfunction in the brain's ability to control movement, problems in the brain areas that coordinate body movements, parietal lobe and midbrain, a chemical imbalance in the brain affecting muscle control, issues in the motor areas of the brain that control movement, causing them to slow down. Why it matters. Asterixis isn't a specific sign for one condition, but it's a sign that something is wrong in the body, often related to problems with the brain or metabolism. If someone shows asterixis, doctors need to investigate further, looking at other signs and the person's medical history to find the cause. Asymmetrical chest expansion. What is asymmetrical chest expansion? Asymmetrical chest expansion happens when one side of the chest moves differently than the other when a person breathes in and out. This can be noticed by looking at the chest from behind or feeling the chest with your hands. If one side doesn't expand or contract as much as the other, it is considered asymmetrical. Conditions associated with asymmetrical chest expansion. 1. More common conditions. Pneumonia, infection in the lungs that makes one side of the lung less able to expand. Pleural effusion, fluid buildup in the space around the lungs, making it harder for the affected lung to expand. Flail chest, broken ribs that move out of sync with the rest of the chest during breathing, usually due to trauma. Foreign body, an object blocking the airway can prevent the lung from expanding properly. Pneumothorax, a collapsed lung where air leaks into the chest cavity, causing reduced expansion on one side. 2. Less common conditions, unilateral diaphragm paralysis. When one side of the diaphragm, the muscle that helps you breathe, doesn't work, the lung on that side won't expand properly. Hemothorax, blood in the chest cavity, often from injury, can affect lung expansion. Musculoskeletal abnormalities, conditions like kyphoscoliosis, curved spine, can physically compress the lung on one side, reducing its ability to expand. Neuropathy, nerve damage that affects breathing muscles, can cause uneven chest movement. Pulmonary fibrosis, scarring in the lungs can make the lung less flexible on one side, reducing its expansion. How it works. When you breathe in, the chest should expand evenly on both sides. If there's any issue with the muscles, nerves, or lungs on one side, it can cause uneven chest movement. For example, in pneumonia, the lung becomes stiff and doesn't expand fully. In pleural effusion, fluid in the chest makes it harder for the lung to stretch. A foreign object blocking the airway prevents air from reaching one lung. Flail chest caused by broken ribs causes part of the chest to move opposite to the rest of the chest. Kyphoscoliosis can push one lung down, making it harder for that lung to expand. Why it matters. Asymmetrical chest expansion always indicates a problem. It's a useful sign for diagnosing conditions like pleural effusion, where fluid accumulates around the lungs. In fact, it's a strong predictor of pleural effusion, sometimes even more reliable than other signs like vocal resonance. If asymmetrical chest expansion is observed, further medical investigation is needed. Asynchronous respiration. What is asynchronous respiration? Asynchronous respiration is abnormal breathing where the chest moves in an irregular way. Near the end of breathing in, inspiration, the chest may suddenly move inward and then quickly follow with an outward movement, even though the chest is still pulling inward. This double movement is irregular and hard to see clearly without special tools. Conditions associated with asynchronous respiration: COPD, chronic obstructive pulmonary disease, a condition that makes it hard to breathe. Respiratory distress, difficulty breathing, which could be caused by various conditions. How it works. Asynchronous breathing happens when the chest muscles, which help with breathing, are forced to work harder during forced exhalation. These muscles push the diaphragm, the muscle that helps you breathe, down and make the abdomen stick out. This can cause the irregular chest movements. Why it matters. Asynchronous breathing can be a sign of a serious problem, especially in people with COPD. It often shows that the person has more severe breathing difficulties and may need extra support, like mechanical ventilation, a machine to help with breathing. It is linked to a worse prognosis, meaning the outcome or recovery might not be as good. Ataxic. What is ataxic Biot's breathing? Ataxic breathing is an irregular breathing pattern where the rate and depth of breathing are erratic, unpredictable, and it is often followed by short pauses, apnea, where the person stops breathing for a moment. These pauses alternate with periods of breathing. Conditions associated with ataxic breathing. More common: stroke, a blockage or bleeding in the brain that affects brain function. Less common: neurodegenerative disorders, conditions like Shy-Drager syndrome, where the nervous system breaks down over time. Meningitis, an infection causing inflammation of the membranes around the brain and spinal cord. Chronic opioid abuse, long-term use of drugs like painkillers, which can affect the brain's control of breathing. How it works. The exact cause of ataxic breathing isn't fully understood, but it is believed to be due to problems in the brainstem, particularly in the medulla, which is the part of the brain that controls automatic functions like breathing. When this part of the brain is damaged or not working properly, it leads to the irregular and erratic breathing pattern. Why it matters. Ataxic breathing can be a sign of brainstem problems, especially issues in the medulla. It is often seen in patients who have had a stroke in the medulla, and many of them show this abnormal breathing pattern. If someone shows signs of ataxic breathing, it is important to check for damage to the brainstem, as it indicates serious underlying issues. What is chest diameter ratio? This refers to the measurement of the chest in two directions: front to back, anterior-posterior, or AP, and side to side, lateral. Normally, the side-to-side measurement is larger than the front-to-back measurement. The ratio of the front to back AP diameter to the side to side lateral diameter should be between 0.70 and 0.75. If the ratio is greater than 0.9, it indicates an abnormality. Conditions associated with an abnormal ratio: chronic bronchitis, a long-term inflammation of the airways in the lungs, often caused by smoking; emphysema, a condition where the lungs are damaged, making it harder to breathe. Also seen in older adults, sometimes this change in chest shape can happen naturally with age, even without lung disease. How it works: the change in chest shape is thought to be caused by overuse of certain muscles, like the sternocleidomastoid muscles, which help lift the upper ribs and sternum, breastbone. When these muscles work too hard over time, due to breathing problems, like in chronic bronchitis or emphysema, they can cause changes in the shape of the chest, making the front to back diameter larger compared to the side to side measurement. Why it matters: an abnormal chest diameter ratio suggests that the chest shape has changed, often due to long-term breathing issues. It can be a sign of conditions like chronic bronchitis or emphysema. If this change happens in older adults without any disease, it is usually not a cause for concern, but it still indicates that the chest shape has been affected over time. Bradypneaing. What is bradypnea? Bradypnea is when someone's breathing is unusually slow. For adults, this means breathing less than 8 to 12 breaths per minute. Conditions associated with bradypnea: 1. More common, drugs. Certain medications like opiates, painkillers, benzodiazepines used for anxiety, barbiturates, sleeping pills, and anesthetics can slow down breathing. Respiratory failure, when the lungs can't get enough oxygen or remove enough carbon dioxide. Brain injury and raised intracranial pressure. Injury to the brain or high pressure in the brain can affect the breathing centers. Hypothyroidism, a condition where the thyroid gland doesn't produce enough hormones, which can slow down body functions, including breathing. Excess alcohol consumption. Drinking too much alcohol can slow down the brain's control over breathing. 2. Less common, hypothermia. When the body temperature is dangerously low, it can slow down breathing. Uremia, a condition caused by kidney failure where waste builds up in the blood. Metabolic alkalosis, a condition where the body becomes too alkaline, too much base, which can cause the body to slow down breathing. How it works: bradypnea happens when something affects the body's natural drive to breathe. Decreased brain function. If the brain's respiratory centers, like in brain injury or drug overdose, stop sending strong enough signals to breathe. Problems with nerves or muscles. If the nerves that control the breathing muscles, like in motor neuron disease, or the muscles themselves, due to tiredness and respiratory failure, don't work well, it can slow down breathing. Body's response to metabolic changes. For example, in metabolic alkalosis, the body reduces breathing to keep in carbon dioxide and balance its acid-base levels. Why it matters: bradypnea is not normal and can be a sign of serious problems. It often happens before someone's breathing stops completely, like in asthma or respiratory failure. If someone has bradypnea, it's important to act quickly and find out what's causing it. Bronchial. What are bronchial breath sounds? Bronchial breath sounds are loud, harsh, and high-pitched sounds that are normally heard over the trachea, windpipe, and bronchial tubes, large airways in the lungs. However, if these sounds are heard over lung tissue during a physical exam, it is abnormal. Conditions where bronchial breath sounds may be heard: normal, over the trachea, windpipe, and bronchial tubes. Pneumonia. If there's an infection in the lungs, you may hear these sounds over the area where the infection is located. Consolidation. Pleural effusion. When there is fluid in the pleural space, the area between the lungs and chest wall, you may hear these sounds above the fluid. Large pericardial effusion. Fluid around the heart may cause similar sounds near the chest. Atelectasis. Partial collapse of the lung. Tension pneumothorax. A serious condition where air gets trapped in the chest, causing lung collapse. How it works: normally, bronchial breath sounds are not heard over the lung tissue because the chest wall blocks higher-pitched sounds. However, if the lung is consolidated, e.g. in pneumonia, the lung tissue becomes denser and the higher-pitched bronchial sounds can pass through and be heard over the affected area. Why it matters. Bronchial breath sounds can be a sign of lung problems. In patients with a cough and fever, hearing these sounds can suggest pneumonia, making it an important sign to check for. Cough reflex. A cough is a quick, forceful release of air from the lungs, which helps clear the airways. It is a protective reflex that helps remove irritants from the respiratory system. Conditions that can cause a cough. Short-term cough, less than 3-4 weeks. Common conditions. Upper respiratory infections, like the common cold. Asthma, bronchitis, pneumonia, inhaled particles or foreign objects. Exacerbation of COPD, worsening of chronic obstructive pulmonary disease. Pulmonary embolism, blood clot in the lungs. In children, bronchiolitis, croup, long-term cough more than 8 weeks, postnasal drip, mucus dripping down the throat, bronchiectasis, damaged airways. Asthma, certain medications, like ACE inhibitors, common blood pressure medicine. Lung diseases, like interstitial lung disease. How the cough reflex works. The cough reflex happens in stages. 1. Sensory phase. Specialized receptors in the lungs detect irritants like infection, inflammation, or foreign objects. These receptors send signals to the brain to trigger the cough. 2. Inspiratory phase. The body takes a big breath in, stretching the muscles in the chest to build up pressure. 3. Compressive phase. The throat closes to keep air in, while pressure builds up inside the chest. 4. Expiratory phase. The throat opens, and the pressure forces air out quickly, pushing irritants from the lungs. Why a cough matters. A cough is common and can be a sign of many different conditions, so it needs to be considered along with other symptoms. For example, cough with colored sputum, mucus, suggests an infection, like pneumonia. A dry cough that lasts for months, especially in someone who smokes, could suggest COPD or lung cancer. A cough that happens during exercise or at night may suggest asthma. Types of cough and what they mean. Lung cancer. If cough occurs with chest pain and blood in the mucus, it might suggest lung cancer, particularly in cases of central tumors in the large airways. Immunocompromised patients, those with weak immune systems, should be watched for infections that may cause a persistent cough, like pneumonia or tuberculosis. Key points to remember. A productive cough, coughing up mucus, is usually from an infection. A dry, persistent cough in someone who smokes a lot may point to COPD or lung cancer. In children, the sound or type of cough can help identify the cause, e.g. a barking cough could suggest croup. The character of the cough, like whether it's dry, wet, or noisy, helps doctors figure out the underlying cause. What are crackles? Crackles are short, popping sounds you hear when listening to someone's chest while they breathe. These sounds are often heard during inhalation, breathing in, but sometimes during exhalation, breathing out too. Coarse crackles are heard in larger airways. Fine crackles are heard in smaller airways. Conditions associated with crackles. Crackles can happen in many different lung problems, such as asthma, chronic obstructive pulmonary disease, COPD, bronchiectasis, damaged airways, pulmonary edema, fluid in the lungs, often from heart failure, pneumonia, lung cancer, interstitial lung disease, like pulmonary fibrosis, where lung tissue becomes stiff. How crackles happen. Crackles occur when air moves through narrowed or blocked airways, often due to mucus or fluid. This can happen when the airways are inflamed or swollen. Inspiratory crackles. These are more common. When you breathe in, the pressure inside the lungs becomes negative, which can cause closed or narrowed airways to suddenly pop open. When they open, air moves through them quickly, creating a popping sound. Expiratory crackles. These are less common and harder to explain. Two main ideas about why they happen. 1. Trapped gas. This theory suggests that air gets trapped in the lungs during breathing out. The positive pressure from exhaling forces the airways open, making a crackling sound. 2. Collapse of small airways. This theory suggests that the airways close when you breathe out because the pressure isn't enough to keep them open, causing them to collapse and create crackles. Why crackles matter? Crackles are usually a sign of a lung problem. The type of crackles you hear can help doctors understand the cause. Fine, late inspiratory cory crackles are strongly linked with pulmonary fibrosis, scarring of the lungs. This is a very specific sign. Coarse crackles, heard during inspiration, are often found in congestive heart failure, fluid buildup in the lungs due to heart problems. Early inspiratory crackles can suggest chronic airflow obstruction, common in diseases like COPD. Expiratory crackles are less common and not very specific. They can happen in many different lung diseases. In summary, crackles are an important sign of lung disease, and their type and timing, when they occur during the breathing cycle, can help doctors figure out what might be wrong. Dyspnea, shortness of breath. What is dyspnea? Dyspnea is when you feel like you are working harder to breathe or feel short of breath. It's a symptom, not something a doctor can see or measure directly. It's the feeling of struggling for air or not being able to take in enough. Conditions associated with dyspnea. It can happen with many different conditions, especially ones that affect breathing or the heart. Respiratory disorders like COPD, pulmonary fibrosis, pneumonia. Heart problems like heart failure. Anemia, low red blood cells. Bronchoconstriction, narrowing of airways like in asthma. Deconditioning, not being physically fit. Why does dyspnea happen? Dyspnea happens when certain parts of your body, like the lungs, heart, or brain, send signals that you need to work harder to breathe. The feeling can come from different causes. 1. Air hunger. This happens when your body feels it needs more air, often because of low oxygen or high carbon dioxide levels. 2. Increased work of breathing. When it's harder to breathe, like when the lungs are blocked or stiff, you feel like you have to put in more effort. 3. Irritation or tightness in the chest. This happens when the lungs or airways are irritated, causing a feeling of tightness or constriction. How does the body sense dyspnea? Brain and muscles. Your brain controls the muscles that help you breathe. When it senses your breathing is harder, it sends signals to your brain to make you more aware of the effort. This feeling of increased effort is called corollary discharge. Chemoreceptors, sensors for gases. The body has sensors that detect the levels of carbon dioxide, CO2, and oxygen, O2, in the blood. Hypercapnia, too much CO2, makes you feel like you need to breathe more. This is often the biggest cause of breathlessness. Hypoxemia, low oxygen, can also make you feel short of breath, but it's not as strong a trigger as high CO2. Receptors in the airways. The lungs and chest have sensors that tell your brain about the state of your airways. If the airways are blocked, inflamed, or stretched, they send signals that can make you feel tightness or discomfort. Chest wall sensors. The muscles in your chest can also sense how much effort is needed to breathe. If the chest can't expand properly, it can increase the feeling of breathlessness. Other causes. Neurochemical dissociation. If the body suddenly needs to work harder to breathe, like during exercise or in disease, but the body doesn't increase breathing efforts to match, this can cause more shortness of breath. Deconditioning. If you aren't physically active, your muscles become weaker. When you do exert yourself, your muscles may produce acid faster, causing your body to increase the signals for breathing, which can make you feel short of breath even more quickly. In summary, dyspnea is a feeling of breathlessness or increased effort to breathe, and it can happen due to many conditions affecting the lungs, heart, or the nervous system. It happens when there is either too much work required to breathe, not enough oxygen, or a feeling of chest tightness. Different parts of the body, like the brain, lungs, and chest muscles, work together to create this sensation. COPD and dyspnea, shortness of breath. What causes shortness of breath in COPD? 1. Low oxygen, hypoxemia. When oxygen levels are low, special sensors in the body send signals to the brain to make you breathe faster, increasing your breathing effort. 2. High carbon dioxide, hypercapnia. If there's too much carbon dioxide in the body, it makes you feel like you need more air, called air hunger. The body also sends signals to breathe faster to get rid of the extra carbon dioxide. 3. Blocked airways and lung inflation. COPD often causes the airways to become blocked and the lungs become too stretched out, hyperinflated. This makes it harder for the muscles that help you breathe to work, increasing the feeling of breathlessness. 4. Deconditioning, weak muscles. When muscles, especially breathing muscles, become weak, often due to lack of exercise, it makes breathing harder and increases shortness of breath. Anemia, low red blood cells. In anemia, it's not fully clear why shortness of breath happens, but there are a couple of possible reasons. 1. Low oxygen levels. When your blood doesn't carry enough oxygen, your heart beats faster, tachycardia, to try to compensate. This increases pressure in the heart and can cause fluid to build up in the lungs, which makes it harder for the lungs to expand and leads to breathlessness. 2. Acidosis. Lack of oxygen can also cause acidity in the muscles, which makes your body feel more effort in breathing. Heart failure. In heart failure, shortness of breath can happen for 2 reasons. 1. Low oxygen, hypoxemia. The heart is not pumping blood well, so the lungs don't get enough oxygen. 2. Fluid buildup, interstitial edema. Fluid can leak into the lungs, which makes the lungs stiffer and harder to expand. This increases the work of breathing and causes shortness of breath. Asthma. In asthma, shortness of breath occurs because 1. Narrowing of airways, bronchoconstriction. The airways tighten up, making it harder to breathe and increasing the effort needed. 2. Swelling in the airways, airway edema. This adds more resistance to breathing, making it feel like you are working harder. 3. Hyperinflation. When the lungs are overly stretched, hyperinflation, it changes the shape of the diaphragm, making it harder to breathe effectively. 4. Irritation. Asthma can irritate the airway receptors, sending signals to the brain that create a feeling of tightness in the chest. Neuromuscular disorders. In neuromuscular diseases, the brain sends normal signals to breathe, but the muscles or nerves that help you breathe are weak or damaged. This means the brain has to work harder to get the muscles to function, which increases the feeling of effort in breathing, dyspnea. Why is dyspnea important? While dyspnea, shortness of breath, itself isn't a specific sign of one condition, it is an important symptom to investigate, especially when it occurs at rest. It can be an early sign of chronic heart or lung problems. For example, in heart failure, dyspnea at rest is very common and suggests the need for further tests. But since dyspnea can happen in many different conditions, it's more useful when considered alongside other symptoms and tests. For example, people with dyspnea may have heart failure or chronic lung disease. Funnel chest, pectus excavatum. What is funnel chest? Funnel chest is a condition where the chest appears sunken or concave. This happens because the ribs and sternum, breastbone, grow in an abnormal way, causing the chest to cave in. Conditions associated with funnel chest. Congenital birth-related disorder. It's the most common abnormality in the chest wall that people are born with. It can also be seen with congenital diaphragmatic hernia, a condition where a hole in the diaphragm allows abdominal organs to move into the chest. What causes funnel chest? The exact cause of funnel chest is not fully understood. Here are some things we know. It was once thought that the cartilage, the soft part of the chest bone, grew too much, but recent studies suggest this isn't the main cause. There is no known specific genetic defect responsible for it, but about 37% of people with this condition have a close family member who also has it, which suggests a genetic link. It can be seen in Marfan syndrome, a condition that affects the connective tissues in the body. In the past, it was believed that repeated chest infections during childhood could cause this condition, but there is no strong evidence to support this. Why is funnel chest important? Pectus excavatum can sometimes be linked to heart problems and lung function issues. People with this condition may need to be checked for possible complications related to the heart or lungs. What is grunting? Grunting is a short, moaning, or crying sound made when someone exhales, breathes out. It's often heard in children or newborns, neonates, especially when they're having trouble breathing. Conditions linked to grunting. Grunting usually happens when there's a problem with breathing. Some common causes include respiratory distress syndrome, a lung issue common in newborns; meconium aspiration, when a baby inhales the first stool during birth; pneumonia, lung infection; congestive heart failure, heart doesn't pump blood well; Less common causes include sepsis, severe body infection, heart failure, heart issues in older patients. Why does grunting happen? Grunting happens when a person tries to force air out of the lungs against a closed throat, glottis. This increases the pressure inside the lungs and helps keep the small airways open longer. This is important because it allows more time for the lungs to exchange oxygen and carbon dioxide. The grunt itself happens when the throat suddenly opens and air flows out forcefully. Why is grunting important? Grunting is an important sign that someone is in serious respiratory distress and needs immediate medical attention. It shows that the person is struggling to breathe properly. Hemoptysis, coughing up blood. What is hemoptysis? Hemoptysis is when someone coughs or spits up blood that comes from the lungs or bronchial tubes, the tubes that carry air into the lungs. Conditions linked to hemoptysis. There are many possible causes of hemoptysis, including common causes, infections, such as bronchitis, pneumonia, or tuberculosis, cancer, lung cancer or tumors in the airways, pulmonary embolism, a blood clot in the lungs, foreign body, something stuck in the airways, airway trauma, injury to the lungs or airways, idiopathic, sometimes the cause is unknown, pulmonary venous hypertension, high pressure in the blood vessels of the lungs. Less common causes, hereditary hemorrhagic telangiectasia, a condition that causes blood vessel problems, coagulopathy, blood clotting problems, Wegener's granulomatosis, an autoimmune disease affecting blood vessels, Goodpasture syndrome, an autoimmune condition affecting the lungs and kidneys. How does hemoptysis happen? The main cause of hemoptysis is damage to the blood vessels in the lungs or airways. Here's how it can happen. 1. Cancer. Tumors can grow into the airway walls and blood vessels, causing bleeding. Tumors may also have fragile blood vessels that easily break. 2. Pulmonary venous hypertension. When the heart's left side isn't working properly, it can raise the pressure in the lungs, damaging the blood vessels and causing bleeding. 3. Infection. Infections can cause swelling and inflammation in the lungs, which can damage blood vessels. Coughing a lot during an infection can also hurt the blood vessels, leading to hemoptysis. Why is hemoptysis important? Hemoptysis is serious and should always be checked by a doctor. While it's not specific to one disease, it can be a sign of things like cancer, infection, or blood clots in the lungs. It's important to find out the cause. Harrison's sulcus. What is Harrison's sulcus? Harrison's sulcus is a visible depression or groove in the lower ribs just above where the diaphragm, the muscle that helps you breathe, attaches. It looks like a soft area in the ribs. Conditions linked to Harrison's sulcus. It can be seen in conditions like rickets, a bone disease in children, severe asthma in childhood, cystic fibrosis, a lung disease, pulmonary fibrosis, lung scarring. How does Harrison's sulcus happen? In rickets, the bones don't get enough calcium, so they become soft and weak. This makes them bend when the diaphragm pulls on them during breathing. In children with severe asthma or chronic lung diseases, the muscles used for breathing can also cause the ribs to bend inward, especially before the bones fully harden and strengthen. What is Hoover's sign? Hoover's sign is when the lower sides of the chest, the costal margins, move inward instead of outward when someone breathes in, inspiration. Normally, the sides of the chest move outward when breathing in. Conditions linked to Hoover's sign. Hoover's sign is often seen in people with emphysema, a type of lung disease, chest hyperinflation, when the lungs are overexpanded. How does Hoover's sign happen? In conditions like emphysema, the lungs become overinflated, hyperinflated, which causes the diaphragm, the muscle that helps you breathe, to stretch. When the diaphragm tries to contract, pulling down to help you breathe, instead of moving the chest outward like normal, it causes the sides of the chest to move inward. This is the paradoxical movement seen in Hoover's sign. Why is Hoover's sign important? Hoover's sign can be a clue to more severe lung disease, especially in conditions where the airways are blocked or damaged, like obstructive airway diseases, e.g. emphysema. Though not often seen today, it can still be useful in diagnosing severe lung issues. A study showed that Hoover's sign is present in about 58% of people with obstructive airways disease and is particularly common in more severe cases. Hypertrophic pulmonary osteoarthropathy, HPOA. What is HPOA? HPOA is a condition where there is abnormal growth of skin and bone at the ends of the limbs, often leading to clubbing of the fingers or toes. In more severe stages, it can cause thickening of bones and joint fluid buildup, synovial effusions. Conditions linked to HPOA. HPOA can be caused by several different conditions, including cyanotic heart disease, a heart condition where oxygen levels in the blood are low, lung cancer, especially types like bronchogenic or pleural cancer, inflammatory bowel disease, infective endocarditis, infection of the heart's inner lining. How does HPOA happen? The exact cause of HPOA is still being studied, but it's thought to involve platelets, blood cells that help with clotting, that don't break down in the lungs as they should. These large platelets or other large cells can travel to the fingers and toes, where they interact with blood vessels and cause growth factors like VEGF, vascular endothelial growth factor, to be released. This leads to growth of blood vessels, vascular hyperplasia, thickening of bone layers, periosteal proliferation. In lung cancer especially, there is an increased amount of VEGF in the blood and fingers, which helps grow new blood vessels and can lead to HPOA. Why is HPOA important? HPOA is a sign of an underlying problem and needs to be investigated further. It's not a disease by itself, but a symptom of other conditions, such as lung cancer or heart disease. If someone has HPOA, doctors need to look for the underlying cause to treat it properly. Hyperventilation. What is hyperventilation? Hyperventilation is when someone breathes faster or deeper than normal, more than what the body actually needs for its metabolic processes. This is usually linked with fast breathing, tachypnea, conditions that can cause hyperventilation. There are three main categories of causes for hyperventilation. 1. Psychiatric causes, anxiety, panic attacks. These psychological issues can make people feel like they need to breathe faster, often because they are worried about things like chest pain, leading to overbreathing. 2. Organic, physical causes, asthma, pneumonia, COPD, chronic obstructive pulmonary disease, pulmonary embolism, a blood clot in the lungs, pain. These conditions can cause the body to need more oxygen or to try and get rid of excess carbon dioxide, leading to faster breathing. 3. Physiological causes, metabolic acidosis, when the body becomes too acidic, pregnancy. During pregnancy, hormonal changes can make the body more sensitive to low oxygen levels, causing faster breathing. How does hyperventilation happen? Several factors can lead to hyperventilation. 1. Psychiatric factors, anxiety and panic attacks. People with anxiety may overbreathe because their bodies are more sensitive to changes in carbon dioxide levels. When anxious, they might misinterpret chest pain as a heart attack, causing their body to react by speeding up breathing. 2. Respiratory diseases, asthma, pulmonary embolism. In asthma, breathing faster can be a response to low oxygen levels or difficulty breathing. In pulmonary embolism, a blood clot in the lungs can lower oxygen, triggering faster breathing. 3. CNS, brain disorders. Damage to certain areas of the brain that control breathing can cause abnormal breathing patterns, including hyperventilation. 4. Physiological responses, metabolic acidosis. When the body becomes too acidic, it tries to remove excess carbon dioxide by breathing faster. Pregnancy. Hormonal changes during pregnancy make the body more sensitive to low oxygen, which can lead to faster breathing. Summary. Hyperventilation can happen for many reasons, from anxiety and panic attacks to physical conditions like asthma and pregnancy. It happens when the body breathes faster than necessary, often as a response to low oxygen levels, increased carbon dioxide, or other factors. The exact cause depends on the situation. But the main idea is that the body is trying to adjust to a problem like low oxygen, illness, or anxiety. Intercostal recession. What is it? Intercostal recession happens when the skin and soft tissue between the ribs get pulled inward during breathing, especially when someone is struggling to breathe in respiratory distress. Conditions associated with it. It can happen with many different breathing problems, like hyaline membrane disease, common in newborns, pneumonia, bronchiolitis, anaphylaxis, severe allergic reaction, croup, a viral infection that causes a barking cough, epiglottitis, swelling of the throat, foreign body inhalation, breathing in something that blocks the airway. Why does it happen? When someone is having difficulty breathing, the body works harder to get air. The muscles around the chest work extra hard, and the pressure inside the chest drops more than normal. This makes the skin and soft tissue around the ribs get sucked in as they try to help with breathing. What does it mean? Intercostal recession is a sign that someone is struggling to breathe and needs medical attention. It's not a specific sign for one illness, but it shows that the person's body is working harder than usual to breathe. Kussmaul's breathing. What is it? Kussmaul's breathing is a pattern of breathing that's deep and rapid, often seen when someone is feeling air hunger or trying to breathe more effectively. It's usually a response to certain health problems. Conditions associated with it. It's most often seen in situations where there's metabolic acidosis, a condition where the body becomes too acidic. Some common causes are diabetic ketoacidosis, a complication of diabetes, sepsis, body-wide infection, lactic acidosis, caused by a buildup of lactic acid. Less common causes include severe bleeding, kidney failure, poisoning, or diarrhea. Why does it happen? When the body becomes too acidic, it tries to get rid of the excess acid, carbon dioxide, by breathing more deeply and rapidly. This is called Kussmaul's breathing. By breathing deeply, the body can blow off more carbon dioxide, helping to balance the pH and reduce the acidity in the blood. What does it mean? Kussmaul's breathing is a strong sign that the body is trying to fight a serious problem, like metabolic acidosis. It's a useful sign for doctors, especially in children, to recognize severe dehydration, 5% or more. Both intercostal recession and Kussmaul's breathing are signs of severe breathing difficulty and should be taken seriously for immediate medical assessment. Orthopnea. What is it? Orthopnea is difficulty breathing that gets worse when lying down on your back. It can make people feel short of breath when they try to sleep or relax in a lying position. Conditions associated with it. Orthopnea is often seen in people with congestive heart failure, CHF, COPD, chronic obstructive pulmonary disease, asthma. Why does it happen? When people lie down, fluid from the lower parts of the body, like the legs and abdomen, moves into the upper body. This extra fluid makes it harder for the heart to pump blood properly, especially if the left side of the heart isn't working well, as in heart failure. This leads to a buildup of fluid in the lungs, which makes it harder to breathe. In people with heart failure, the following things happen when they lie down. 1. Fluid buildup. Blood and fluid flow back to the lungs, causing fluid to fill the lung tissues, which makes it hard to breathe. 2. Increased airway resistance. The airways get more narrow, making it harder to breathe. 3. Wheezing or cardiac asthma. The airways can become blocked, causing wheezing. 4. Reduced lung expansion. The lungs may not expand as well, reducing the amount of air that can enter the lungs. 5. Difficulty exhaling. It becomes harder for the person to push air out of their lungs when lying down, making it feel like they're trapped in their breath. What does it mean? Orthopnea is a sign that something might be wrong with the heart, especially in congestive heart failure, CHF. If someone has orthopnea, it helps doctors consider heart failure as the cause of the breathing problem. Significance. If someone has orthopnea, it suggests a heart issue, especially if they have other symptoms of heart failure. If this symptom is absent, it may help rule out heart failure as the cause of their breathing trouble. Paradoxical abdominal movements, abdominal paradox. What is it? Normally, when you breathe in, inhale, your diaphragm moves down and the front of your abdomen moves out. But in paradoxical abdominal movements, the opposite happens. The abdomen moves in when you breathe in during inspiration and moves out when you breathe out during expiration. Conditions associated with it. Neuromuscular diseases like bilateral diaphragm weakness, diaphragmatic paralysis, when the diaphragm is paralyzed, diaphragmatic fatigue, when the diaphragm gets tired and doesn't work properly. Why does it happen? The diaphragm is a main muscle used in breathing. If it doesn't work properly due to paralysis, weakness, or fatigue, other muscles, like the chest wall muscles, take over the job of breathing. However, these muscles don't move the diaphragm properly. Instead of pushing the abdomen out when breathing in, they create negative pressure that sucks the abdominal contents upward, causing the abdomen to move inward. What does it mean? Paradoxical abdominal movements are always abnormal and usually indicate a serious problem with breathing. It should be investigated immediately. Paradoxical respiration, breathing. What is it? Paradoxical breathing is when a part of the chest or lung moves inward instead of outward when you breathe in. This is the opposite of normal breathing, where the chest expands when you inhale. Conditions associated with it: COPD, chronic obstructive pulmonary disease; pneumonia; airway obstruction, blocked airways; diaphragm paralysis; flail chest, a condition where parts of the chest wall break and move abnormally. Why does it happen? When the diaphragm becomes weak or paralyzed, the chest muscles take over breathing. These muscles create strong negative pressure during inspiration, breathing in, which can cause the chest to move inward rather than outward. This is especially noticeable in children because their chest walls are more flexible. The diaphragm may also be pulled upward, making the abdomen move inward instead of outward when inhaling. What does it mean? Paradoxical breathing is a severe sign of respiratory distress, difficulty breathing. It needs immediate medical attention because it shows the body is struggling to breathe properly. Paroxysmal nocturnal dyspnea (PND). What is it? PND is a condition where a person suddenly becomes short of breath or experiences difficulty breathing during sleep, typically at night. This may also cause coughing or wheezing. It can wake the person up from their sleep. Conditions associated with it: congestive heart failure, CHF. Why does it happen? The exact cause of PND is not fully understood, but it's believed to be a mix of factors. 1. Increased blood returning to the heart from the legs and body while lying down. 2. Decreased support for the heart during sleep, making it harder for the heart to pump blood. This leads to fluid buildup in the lungs, causing difficulty breathing. 3. The natural depression of breathing control centers during sleep, which makes breathing less efficient. 4. Increased pressure in the airways, which can make breathing harder. These factors can lead to less space in the lungs, causing a feeling of breathlessness. This triggers receptors in the lungs and chest wall to send signals to the brain, waking the person up to help fix the breathing problem. What does it mean? PND is an important symptom for diagnosing heart failure. If a person has PND, it suggests heart failure, but if they don't have it, it can help rule out heart failure.
Gosh.
What is it? Percussion is a technique used by doctors where they tap on the body to listen to the sounds produced. This helps the doctor understand what's going on inside the body, especially in the lungs. When doctors use percussion, they can hear 3 types of sounds. 1. Tympany, a drum-like sound. 2. Resonance, hyperresonance, a hollow sound. 3. Dullness, a soft, flat sound. Different diseases or problems in the body can make these sounds, and the doctor uses these sounds to figure out what might be wrong. Theories behind percussion sounds. There are 2 theories about how percussion sounds are made. 1. Topographic percussion theory. This theory says that only the tissues directly under where the doctor taps make the sound. 2. Cage resonance theory. This theory suggests that the sound also depends on how the body wall vibrates when tapped, which is influenced by the strength of the tap and the health of the organs. Doctors mostly use the cage resonance theory to explain the sounds. Percussion, dullness. What is it? Dullness is a sound that happens when the doctor taps on the chest or lungs, and the sound is short and dull instead of hollow. Conditions associated with it: pleural effusions, fluid buildup in the space around the lungs; pneumonia, infection in the lungs. Why does it happen? When there is fluid in the space around the lungs, pleural effusion, it dampens the normal hollow sound of the lungs. This creates the dull sound that doctors hear during percussion. What does it mean? A dull sound on percussion is a good sign that there could be fluid in the lungs, like in pleural effusion or pneumonia. If the doctor compares both sides of the chest and hears this sound, It can help confirm the presence of pleural effusion. Percussion. Resonance? What is it? When doctors tap on the chest, they can hear different sounds. Resonance. A normal, low-pitched hollow sound heard over healthy lungs. Hyperresonance. A louder and deeper sound than resonance, often heard in certain lung conditions. Conditions associated with it. Normal lung fields. You hear resonance, which is normal. Pneumothorax, a collapsed lung. You hear hyperresonance. Chronic obstructive pulmonary disease. You also hear hyperresonance. Why does it happen? Hyperresonance happens when the lungs are overly inflated, as in conditions like COPD or pneumothorax. This allows the sound of the percussion blow to travel more clearly, making the sound louder and deeper. What does it mean? Hyperresonance is a sign that someone may have chronic airflow problems or a collapsed lung, especially if the lungs are more inflated than usual. Periodic breathing. What is it? Periodic breathing is a pattern of breathing where the breath volume changes in a cycle. The smallest breath taken is less than half of the largest one, and it can occur regularly. It is similar to Cheyne-Stokes respiration, where the breathing pattern fluctuates in cycles. Conditions associated with it: stroke, subarachnoid hemorrhage, bleeding in the brain, congestive heart failure. Why does it happen? This breathing pattern is thought to occur because the brain's respiratory control system temporarily loses its ability to control breathing. The brain might not detect the right level of carbon dioxide, CO2, in the blood, causing the breathing pattern to change. In strokes or other neurological disorders, this happens because the brain's control centers for breathing, in the brainstem, are affected. What does it mean? Periodic breathing is often seen in people with heart disease or after a stroke. It is a serious sign because it is linked to worse outcomes like higher risk of death. In heart disease, it's associated with poor heart function. Pigeon chest, pectus carinatum. What is it? Pigeon chest is when the chest sticks out more than usual, making the sternum, the bone in the middle of the chest, and the cartilage between the ribs appear to bow outward. Conditions associated with it: familial. It runs in families. Chronic respiratory illness in childhood. Less common causes: rickets, a bone condition. Marfan syndrome, a connective tissue disorder. Why does it happen? Repeated coughing, like from long-lasting infections, can cause the chest wall to deform, especially when the bones are still soft in children. Over time, this leads to a permanent outward curve of the chest. Some believe overgrowth of cartilage may also play a role, but there isn't much proof of this. What does it mean? Pigeon chest is seen in about 1 in 1,500 births. While it's often a normal, inherited condition, if the person has respiratory problems, the doctor will check if the chest deformity is making breathing harder. What is it? Platypnea is a type of shortness of breath that happens when a person is sitting or standing, but it gets better when they lie down. It is the opposite of orthopnea, where a person has trouble breathing when lying flat. Conditions associated with it. Platypnea can be caused by several different medical conditions, including heart problems, intracardiac shunts, abnormal blood flow inside the heart, atrial septal defect, ASD, and patent foramen ovale, PFO, holes in the heart's walls. Pulmonary hypertension, high blood pressure in the lungs. Lung diseases, chronic obstructive pulmonary disease, COPD, pulmonary embolism, blood clot in the lungs. Acute respiratory distress syndrome, ARDS. Other causes: liver disease, such as hepatopulmonary syndrome. Autonomic neuropathy, nerve issues affecting involuntary body functions. Why does it happen? Platypnea occurs when blood is improperly shunted, redirected from veins to arteries, bypassing the lungs and reducing oxygen levels. There are a few reasons this can happen. 1. Heart problems, like PFO. In people with a PFO, a hole in the heart, blood flow can change when the person sits or stands. When sitting up, more blood is redirected to the heart, which can cause it to flow incorrectly, leading to low oxygen in the blood and difficulty breathing. 2. Lung problems. In diseases like COPD or after surgery to remove a lung, pneumonectomy, lung function changes. This can cause the blood to pass through areas of the lungs that don't have good oxygen, making it harder to breathe when upright. 3. Liver disease, hepatopulmonary syndrome. In liver disease, changes in blood vessels in the lungs can prevent the blood from getting enough oxygen. When a person is sitting, gravity can make this worse by directing blood to poorly oxygenated parts of the lungs. What does it mean? Platypnea is a rare but important sign that suggests an underlying problem where blood flow is not happening properly, often due to a shunt, abnormal blood flow between veins and arteries. If someone has platypnea, it usually means there's an issue that needs to be investigated further. Pleural friction rub. What is it? A pleural friction rub is a loud rubbing or scratching sound heard when a doctor listens to the chest with a stethoscope. This sound is mostly heard when breathing out expiration. Conditions associated with it. Pleural friction rub is most commonly seen in pleurisy, inflammation of the lining around the lungs, lung cancer, pneumonia, pulmonary embolism, a blood clot in the lungs. It can also be seen less often with conditions like rheumatoid arthritis, RA, systemic lupus erythematosus, SL, tuberculosis, TB. Why does it happen? The pleura is the lining around the lungs. When it becomes inflamed due to infection, inflammation, or other conditions, it loses its usual smoothness. This causes friction between the two layers of the pleura when breathing, leading to the characteristic rubbing sound. What is it? What is it? Pursed lips breathing is when a person exhales slowly through pursed lips, like blowing out a candle. Conditions associated with it. Chronic obstructive pulmonary disease, COPD. Why does it help? By pursing the lips, the person creates resistance while breathing out. This helps keep the small airways open, allowing better oxygen exchange and making it easier to breathe. It also helps in breathing more deeply and slowly, improving how well the lungs get oxygen. What does it do? It can reduce shortness of breath, dyspnea. It lowers the breathing rate. It improves oxygen levels in the blood. What is it? What is it? Sputum is the mucus or phlegm that comes up from the lungs, bronchi, or trachea when coughing. It's the substance you might cough up when you're sick. Conditions associated with it. Pneumonia, tuberculosis, bronchiectasis, lung condition causing airways to become damaged, cystic fibrosis, asthma. Why does it happen? Mucus is produced by glands in the airways. When there is irritation, like from a cold, infection, or smoke, the body makes more mucus. The body tries to clear it by coughing it up. This is called the cough reflex. What does it tell us? If the sputum changes color or increases in amount, it could mean a new infection or worsening condition and should be investigated. Green or yellow sputum usually suggests bacterial infection, especially in COPD. Clear or white sputum usually means the mucus is less infected. Sputum tests are helpful in diagnosing infections like pneumonia or TB, but they are not always necessary unless the condition is severe or difficult to treat. What is it? Stertor is a noisy breathing sound, often described as a snoring noise. It is low-pitched and can easily be heard while the person is breathing. Unlike another type of noisy breathing called stridor, stertor doesn't have a musical sound. Where is it heard? Stertor is most commonly heard in children, especially infants, and usually happens when there is gut congestion or nasal stuffiness. It often comes from the nose or throat area, nasopharynx and oropharynx. Conditions associated with it. Stertor is often linked to obstruction or blockage in the nasal or throat area, e.g., from enlarged adenoids or a swollen throat, nasal problems or deformities, epiglottitis, swelling of the part of the throat that covers the windpipe, glioma, brain tumor that can affect the nasal passages. Why does it happen? Stertor happens when the airway is narrowed, which causes the airflow to become turbulent. This usually occurs because something is blocking the airways in the throat or nose. Stridor. What is it? Stridor is a loud, harsh breathing sound that can be inspiratory while breathing in, expiratory while breathing out, or biphasic, both during inhaling and exhaling. It has a constant pitch and is usually caused by an obstruction in the upper airways. Conditions associated with it. Stridor is commonly caused by foreign body in the airway, like food or a small object, croup, a viral infection in children causing inflammation of the windpipe. Paratonsillar abscess, a pus-filled pocket near the tonsils. Aspiration, when something is inhaled into the lungs like food or liquid. It can also be caused by less common conditions like laryngomalacia, softening of the tissues above the vocal cords in babies, subglottic stenosis, narrowing below the vocal cords, tracheomalacia, weakening of the trachea walls. Why does it happen? Stridor happens when there is narrowing or a blockage in the upper airways above the windpipe. This causes turbulent airflow, which creates the sound of stridor. The sound can get louder when the person breathes in because the air pressure inside the airway is lower during inhalation, making the obstruction tighter. What are the different types of stridor? High-pitched stridor, often caused by obstruction at the level of the vocal cords, glottis. Lower-pitched stridor occurs with problems higher in the airways, like the nose or throat. Biphasic stridor. This occurs when the obstruction is at the vocal cords or trachea. Inspiratory stridor occurs when the obstruction is above the vocal cords. Expiratory stridor occurs when there's a collapse of the lower airways. Why is stridor important? Stridor is an important sign of upper airway obstruction. If you hear stridor, it means there's a blockage in the airways that can affect breathing, and it needs to be examined and treated quickly. Subcutaneous emphysema, surgical emphysema. What is it? Subcutaneous emphysema is when air or gas gets trapped under the skin. When you touch the skin, it feels like crackling or the feeling you get when you press on bubble wrap. The skin may look a bit different or feel strange to the touch. Conditions associated with it. This happens when something causes damage to organs or airways, such as trauma, injury, to the lungs or digestive organs. Pneumothorax, collapsed lung. Pneumomediastinum, air in the middle part of the chest. Barotrauma, damage due to pressure changes, like in scuba diving. Esophageal rupture, a tear in the food pipe. How does it happen? Subcutaneous emphysema happens when air or gas leaks into the space under the skin. This can occur after injuries like a punctured lung or during barotrauma when there is high pressure in the lungs. The air can travel along the tubes or spaces inside the body and reach the skin, causing the crackling feeling. Significance. This is an important sign that usually means a serious injury to the chest or lungs. If a person has chest trauma and subcutaneous emphysema, it suggests that the lungs or airways are likely damaged and need urgent attention. Tachypnea, rapid breathing. What is it? Tachypnea means rapid breathing, where the breathing rate is greater than 20 breaths per minute. Conditions associated with it. Tachypnea can happen in many different situations, like heart problems, e.g. heart failure, lung problems, e.g. asthma, pneumonia, brain issues, e.g. head injury, infections, psychiatric conditions. How does it happen? When there's not enough oxygen in the blood, hypoxia, or too much carbon dioxide, hypercapnia, the body tries to breathe faster to fix the problem. The brain, specifically the medulla, and sensors in the body detect these changes and tell the body to breathe faster to bring in more oxygen or remove excess carbon dioxide. Significance. Tachypnea is a valuable sign that shows something is wrong in the body. It is often overlooked, but it can predict serious health issues. It's a warning sign that someone might be heading toward a cardiac arrest or respiratory failure. Patients with a high respiratory rate have a higher risk of death, especially if the rate is over 24 breaths per minute. In pneumonia, a breathing rate of over 27 breaths per minute can help predict whether the patient might need to go to the ICU or could face serious complications. If you notice a sudden change in breathing rate, especially if it's very fast, it means you should investigate the cause quickly, as it could indicate the body is struggling to get enough oxygen or remove carbon dioxide. Here's a simpler explanation of the terms you asked about. Tracheal tug, what it is. This happens when the thyroid cartilage, the part of the throat you can feel, moves downward when someone breathes in. Common causes: respiratory distress, COPD. It's seen when someone is struggling to breathe. The increased work of breathing makes the trachea, windpipe, move down. Aortic aneurysm, Oliver sign. In rare cases, the movement happens because of an aneurysm in the aorta, big artery, which makes the trachea move when the heart beats. Why it happens. In COPD respiratory distress, the muscles working harder to help you breathe can pull the trachea down. In aortic aneurysm, the pressure from the heart's beat can cause the trachea to move. Significance. It's a sign that someone is having trouble breathing and needs attention. Trypopnea. What it is. It's a type of breathing difficulty where it gets worse when a person lies on one side, but gets better if they lie on the opposite side. Common causes. Unilateral lung disease. One lung is sick, and the position of the body makes it harder for that lung to work. Congestive heart failure. Sometimes, heart disease makes people feel better lying on their right side. Lung tumor. A tumor in the lung may press on the lung or blood vessels and affect breathing when lying on one side. Why it happens. Unilateral lung disease. When lying on the side of the healthy lung, gravity helps it work better. Heart failure. Lying on the right side might improve blood flow or reduce pressure on the lungs. Lung tumor. Gravity might affect how the tumor presses on the lung, changing how the person breathes. Significance. This is not normal and should be checked by a doctor. These are signs that something is wrong with the breathing, and doctors will pay attention to them to understand what might be causing the problem. Here's a simpler explanation of these terms. Vesicular breath sounds. What they are. Soft, gentle sounds heard when listening to the lungs with a stethoscope. You hear a short inhale, inspiration, and a very quiet exhale, expiration. What they mean. These sounds are normal and are heard when air moves through the healthy, smaller airways in the lungs. Vocal fremitus, tactile fremitus. What it is. When you place your hands on someone's chest or back and ask them to say 99, you can feel vibrations. These vibrations can be different depending on what's happening inside the chest. What it means. Increased fremitus, seen when the lung tissue is consolidated, like in pneumonia, where the lungs are filled with fluid or infection. Decreased fremitus, seen if there's extra air, like in pneumothorax or COPD, fluid, like in pleural effusion or a tumor. Why it happens. When there's consolidation, sound travels more easily through the tissue, increasing the vibration. When there's air or fluid, the sound is blocked and the vibration is less. Vocal resonance. It's how the patient's voice sounds when you listen with a stethoscope on their back. Normally, you can't hear it clearly, but if there's a problem like a lung infection, the voice may sound clearer. Types of changes. The voice sounds louder than usual. Even whispered words can be heard clearly. The voice sounds like a goat bleating, nasal sound. What it means. These changes often happen when there's consolidation in the lungs, like in pneumonia or a tumor. When there's fluid, like in pleural effusion, the voice sounds muffled. Wheeze. What it is. A high-pitched musical sound made while breathing, usually during exhaling. What it means. It happens when the airways are narrowed, which causes air to flow faster and vibrate the airway walls. It's common in asthma, COPD, respiratory infections, foreign body aspiration. Why it happens. When the airways are tight, the air flows faster, creating the wheezing sound. Wheezing types. Monophonic wheeze. A single, steady sound, often due to a fixed blockage like a tumor or foreign object. Multiple different pitches at once, usually seen in conditions like COPD. These signs help doctors understand if there are problems in the lungs, such as infections, blockages, or fluid buildup.